All right, welcome to The Explainer. Today, we're diving into a health issue that affects literally millions of people, but it often stays totally hidden. Well, until it doesn't. And when it shows up, trust me, it can make a very loud entrance. Okay, let me ask you something. Have you ever felt this? You've just had a great, maybe kind of heavy meal, and then bam, out of nowhere, this sharp, intense pain hits you, right up in your upper abdomen. What on earth is that?
Well, that pain, it's not just random. It's your body waving a big red flag, trying to tell you something's up. And it's often a sign of a condition that, a ton of people have, and they don't even realize it.
There's a reason it's often called the silent enemy. We are talking, of course, about gallstones. So let's pull back the curtain and figure out what is really going on inside. First up, we're going to dig into why they get that nickname, the silent enemy, and how something so common can just fly under the radar. And then we'll get right down to it. What is a gallstone? Like, how does this thing even form in the first place? Okay, so it all kicks off with this little guy, the gallbladder. It's a small organ kind of tucked away right under your liver. Its whole job, its entire purpose, is to store something called bile. And bile is this fluid that is absolutely crucial for helping your body digest fats. So you can think of it like a little storage pouch, ready to squirt out that bile right when you need it. So how does it go from a helpful pouch to a problem? Well, it all comes down to balance. Sometimes the chemical cocktail that is your bile just gets off. It can get way too full of stuff like cholesterol. And when that happens, tiny little crystals start to form. These crystals then stick together, they get bigger, and they harden into these little pebble-like stones. And boom, just like that, you've got these tiny troublemakers setting up shop. Now, here's the crazy part. For a lot of people, these stones can just hang out for years, literally years, and cause zero problems. They're silent. But when they finally decide to make their presence known, oh, they are not quiet about it. And that's what we call a gallstone attack. So a gallstone attack is basically when one of those little stones causes a traffic jam. It creates a blockage. You'll know it from that sharp pain we talked about, and it often comes with feeling sick to your stomach, maybe even throwing up. But I really want you to look at the last couple of points here. This is not just about feeling uncomfortable. A blockage can lead to really serious inflammation. It can even block the whole bile duct, and that's a medical emergency. So these aren't just symptoms. They are urgent, screaming signals from your body. Okay, so you might be wondering, is this something that happens to everybody? The short answer is no, not necessarily. But there are definitely things that can up your chances. Yeah, a few key things can really tip the scales here. For instance, a diet that's super high in fatty foods, or obesity. Both of those can increase the cholesterol in your bile, making stones more likely. The hormonal changes during pregnancy can also be a factor. But here's the one that catches people off guard: losing a lot of weight really fast. You'd think that's a good thing, right? But when you lose weight quickly, your liver goes into overdrive processing fat, and it ends up dumping a ton of extra cholesterol into your bile. It's like the perfect recipe for creating gallstones. Okay, so we get the problem, we get the risks, but what do you do about it? Well, here's the good news. And it really is good news. When it comes to gallstones, figuring out if you have them and then treating them is usually pretty straightforward. And this is so important to hear. If you're having any of these symptoms, please don't let the fear of what if stop you. Finding out what's going on is actually a super simple and totally painless process. So how do they check? Usually it's with a routine ultrasound. Yeah, it's the exact same tech they use to look at a baby during pregnancy. It's completely non-invasive. They just use a scanner on the outside, and it lets the doctor see your gallbladder and any of those little stones that might be hiding in there. It's fast, it's easy, and you get a clear answer. All right, so once you know for sure, what's next? Treatment pretty much goes down one of two roads. On one hand, for cases that aren't too bad, sometimes just changing your diet, specifically going low fat, can be enough to manage everything. But for people who get frequent or really severe attacks, the most effective fix is often a simple surgery to just remove the gallbladder. The key takeaway here is that it's not a one-size-fits-all thing. The treatment is totally tailored to you and how much these stones are messing with your life. But you know, what's even better than treating a problem? Avoiding it in the first place, right? And that brings us to the most powerful part of this whole story: prevention. I mean, This saying is a classic for a reason. Prevention is better than cure. It's so true. Just maintaining a healthy diet, keeping your weight in a good spot, and honestly, just being aware of your body, all of that can go a huge way in keeping your gallbladder healthy and, stone-free. And really, that's the bottom line. Gallstones can be the silent enemy, but a lot of the time, they're not. Your body is sending you signals. A little pain here, some discomfort there. The only real question is, are you listening? Because just paying attention, that's the first and most powerful step you can possibly take. Thanks for joining us on The Explain.